Probably a few different points. Number one, take time for yourself. Like, we're all very busy. Our kids don't sleep. We are running them around. You're all working. You need to keep up with friends. So try to find 5 minutes a day for like inner peace and try to take care of yourself, because self-care is very important for mental health and your overall well-being. So, and I know even 5 minutes is easier said than done. Get your annual mammogram. That will help keep you overall healthy, and you need to go see someone every year, so that just also helps you check in, make sure blood pressure is well controlled. There's no concern from a mammogram standpoint. And then lastly, wear sunscreen, because that will help fight off premature aging, help prevent any melanoma, other skin cancers. And if you don't have a care established with a dermatologist, that's also good for just annual skin checks for everyone. In, I would say 98% of my practice, no, it's usually covered by insurance, and but that's on a case-by-case basis again. Usually women who are candidates for breast reduction are women who have chronic back and neck pain from large breast. You've tried multiple bras, you've exhausted physical therapy, massage therapy, chiropractic therapy. Women get irritation under the breast during warm weather months. You're taking Advil or Tylenol, or you've seen a chronic pain specialist for back and neck pain. In those cases, women are candidates for breast reconstruction, and then we have to submit everything to your insurance company with some pictures, and in the majority of cases, they say yes. Breast reductions can be done for cosmetic reasons, because at the end of the day, the insurance company wants us to say we're going to remove X amount of grams, and that fits into their algorithm based on a woman's height and weight. So if you need less weight taken off, however you still feel like you have large breasts or a lot of extra skin and your breasts are droopy after breastfeeding or with gravity, some of those cases are considered cosmetic, but I would say 98% of my practice, we do breast reductions for insurance. I work quite frequently with a lot of the surgical oncologists and neurosurgeons or thoracic surgeons. So anytime you have a big tumor that's invading like the chest wall or the scalp, and you have to really reconstruct skin, soft tissue, muscle, and bone, those cases can be quite challenging. Part of my training was in microsurgery, so we'll take skin and fat or muscle or bone from one part of your body and basically transplant it. So take it with its blood supply and connect it to the blood supply in the area that needs reconstruction. So those cases are generally require a little bit more brain power and time, and they're a little bit more physically demanding because they're in the range of 5 to 10 to 12 hours depending on how things are going. But those are usually the most, I would say, physically demanding. I think some of the most challenging cases can be the oncoplasties that we do for breast reconstruction, because if a woman comes in with size B breast and she has a tumor that's 1.5 centimeters in diameter, and the breast surgeons have to take a margin, that can be up to 25 to 30% of her breast. And then I have to make it look like her contralateral breast. So we'll either move tissue in from the side of her chest, or rearrange the breast completely and then do a reduction on the other side so that they have symmetry. So those are definitely some of the most demanding from a plastic surgery fundamental standpoint, because you want to replace like with like. Women want to have a nice round soft breast, and I want it to look similar to the other side. So kind of twofold.
That sounds really challenging, and it made me think while you were saying that, how much, as you explained that to patients prior to surgery, how much does that weigh in on their decisions, going, oh, maybe not, but then, many times this is as you and Dr. Leonard work together, this is a medical issue that has had to be addressed.
So it definitely is a conversation that Dr. Leonard and I have quite frequently. It's number one, and I can't say this enough, it's what is the most oncologically safe decision for the woman, short-term, long-term, what's going to get the cancer out. So what is the safe operation for her? And then, cosmesis comes way behind that. It needs to be what's going to be the safe operation for you. So those are things. Women have all different reasons for why they choose what operation they have, but number one is what is safe for you. There's a lot of now multidisciplinary tumor boards, which I think help people, all physicians from each specialty discuss either like a patient with melanoma, there's like the reconstructive surgeon there, surgical oncology, medical oncology, derm path, dermatology. We're all sitting in one room for an hour every week to talk about these patients. For breast cancer, we have tumor board, the radiation oncologist is there, medical oncology, the radiologist is there, Dr. Leonard's there, Kathy's there. So we can all talk about all the patients so that way they can get kind of everyone's on board. We can talk about their overall care. One of the clinics I do at Georgetown, there's a rheumatologist and a dermatologist in the physical clinic, and we see patients together. So I think that's sort of one of the blessings of MedStar branching out and stretching into the community is we're sending specialists there as well, so we can all sort of come together to see patients hopefully in one setting. That's sort of our goal with the Breast Health Center opening in the fall, is that Dawn and I can see patients together. So if you are diagnosed with breast cancer, is any concern, we can see you in one setting versus coming back and forth and back and forth.